Thank you, Las Ceann Comhairle.
The glasses are on order.
Not
the
at
new
all.
glasses.
Las Ceann Comhairle, I am pleased to have an opportunity to speak on what is such an important motion. It is undeniable that COVID-19 has had an impact on the mental health of many people and has in many different forms: loneliness, social isolation, stress, financial pressures, anxiety, and these are just some examples. My colleagues and I in the regional group are very pleased that Government agrees that we need to ensure mental health is a central part of Government's response to the COVID-19 pandemic. The response to the current pandemic should ensure that measures protect not only the population's physical health, but its mental health on an equal basis. COVID-19 is obviously a public health issue, and I believe all of us in this House recognise that, but we do have differing opinions on how best to deal with it. In my view, we must not allow our response to COVID to cause more knock-on problems than it solves. Unfortunately, we have a mental health system that is not adequately prepared to cope with the significant increase in demand experienced over the last few months. Underfunding of the mental health services prior to the pandemic shows clearly that the budget for mental health is struggling to meet the population's needs. The pandemic should not be used as an excuse to deny, delay or curtail access to mental health care and services. My local CAMHS unit in Wexford, where the staff are Trojan in their commitment to patients, but there is still no child psychologist and no dietitian appointed, and this is ongoing for over 2 years. I've seen the devastation firsthand when early intervention is not achieved with these children and they move straight into adult services. Funding is an investment in these children's future, and we must not take that away from them. Long before COVID-19 was ever heard of, we had an epidemic of mental health issues, and it's obvious that the pandemic has served to magnify this. In relation to the specifics of the motion, we are calling on the Government to publish all available data on mental health during the pandemic. We want to ensure that mental health is a central part of the Government's response to the COVID-19 pandemic. This means taking more than just the potential spread of the virus into account when deciding on what activities to ban people from doing. For example, banning someone from visiting a neighbour who lives on their own may help reduce the chances of the virus spreading, but it increases loneliness and social isolation. Human beings are social beings and thrive on the company of others, heartened by their love and support. Christmas is one of the loneliest times for older people. Likewise, how much stress, anxiety and depression has been caused by ordering businesses to close. How many people have been plunged into a state of financial despair as a result of COVID restrictions. In the motion, we call on the Government to design all communications to be sensitive of their potential impact on people's mental health. For example, by communicating empathy for people's distress and including advice for their emotional well-being. With this in mind, there must now be a special mental health task force set up without delay to ensure safe, efficient rollout of the vaccine programme and ensure all services and patients' needs are met. Scaremongering is a word which has been used many times to describe the matter in which COVID-19 information has been communicated to the people. We constantly hear bad news, the worrying news. We constantly hear the worst-case scenarios forecast. But do we hear a fair share of positive news? I think it's 5 months since we had an update on the number of recoveries. Actually, it was the 20th of July. Why hasn't this been updated in 5 months? I recognise that the bad news is being used as a way of trying to get people to take all of the restrictions seriously, but I also recognise that the constant drip feed of misery and doomsday scenario information takes its toll on people. Can the Government ensure that clear data is provided not just on recoveries, but asymptomatic cases, and rather than reporting deaths related to the virus, report deaths from the virus to allow people to understand more? These are just some of the reasons why we're calling for mental health to be a central consideration of Government when deciding on any further COVID-19 measures. I obviously haven't got time to comment on each line of the motion, but I am very pleased that members of all parties and none will see the benefits of supporting this motion to help protect the mental health of our people. Thank you, Ceann Comhairle.